everyone.
Hello.
My name is Conchetta,
I'm Constance.
and we are
CNC Style Me.
And this week we're on part 2 of breast cancer awareness, and we have our special guest with us.
Donna Davis.
And Ms. Davis is going to give an in-depth interview with us, and we're going to get to know her a little bit more.
Yes.
So our first question, Mom, I'm going to let you take it.
Okay, first question is, of course, you've already told us your name, but we want to ask you, is there an organization that you're connected with?
Okay, I am. I'm just giving a little bit quick history of me. I am Donna Davis, as I said before. I am a nurse of 31 years, and currently I am a health and wellness coordinator at my church, Rock of Ages Baptist Church in Maywood. So that would be considered part of my organization that I'm with.
Okay, thumbs up to Rock of Ages.
Hey.
All right. Okay, so we're going to ask you, your second question is, how did you become involved with breast cancer?
So as breast cancer, I have been an advocate for it for quite a while. I would join and do the walks. They have multiple walks throughout the year that you do for the breast cancer survivor and the breast cancer awareness. So I started walking with Making Strides is one of the walks that I did, and I usually cannot stay with her during my walks. But what happened, I really got an advocate for it. 5 years ago, I have a baby sister who died of breast cancer. She was 42, and she died of breast cancer. After her death, and actually before her death, I have an older sister who was actually found with breast cancer as well. She's a 14-year survivor, so there's no need to be the face, because she was a 14-year survivor. Even though I might have lost one, I believe in God's will of what His plans are for our life. So she's a survivor for 14 years. So what I decided to do after that, of not only being an advocate, to get more involved, of understanding about, like, so what does this do? So for Making Stride, what it does, not only do we participate in a walk, there's donations that's made. And you always want to know, we're giving the donations, where's this money going to? What is it for?
Right.
And I can firsthand tell you that I know what it's for and where is it going to. As I said, my baby sister who was found with the breast cancer, she had to go for treatment. During her treatment time, they, you figure they're just giving her treatment and just taking care of her. But there's a lot more that goes behind this besides treating them for breast cancer. Making Strides provide for what they did, was able to provide, and as I said, I can tell you firsthand, for my sister, they will provide you with free wigs. They provide you with a support group. They will provide you, this is what they've done for my baby sister, and I know they do pretty much, this is what they do for all. They provided her, one day she was chosen, she said she was told she could go to this makeup class. Because of course, when you first diagnosed with that, it's very difficult to, cancer. We see cancer and everybody always think, oh my God, it's cancer, it's death. But that is not what cancer is. Always remember, there is can in that word of cancer. You can do this. You can't fight this. You can beat this. So she did. She went to the makeup class, and they gave her multitudes of different makeup. As she was going for her treatment, they would always say, "You're always so pretty. You always stand up." And she always was like that. So we have to remember there's a lot of things that's behind of the treatment. People get sick with it. It's very tough. Element to go through in the treatment care. So you need support, encouragement, and these are the things they offer to help. If there's a ride, if you don't have a ride to get to your treatment, you get free rides. So the funds, the donation that we donate for this, not only being an advocate to coming out to do the walks, but donations, is to help those who are less fortunate, who may not have these things, and to get them so they don't have to worry about this. I've always said this for cancer patients. Cancer patients should never have to worry about any financial burdens.
Yes.
You worrying about your life, your sickness. Am I going to make it? There should not be any burdens of cancer patients. I pray to God that eventually there will be a law that they will be able to come up with a law of financial, any financial way to be able to help these who has to go through this. As I said, it's been in my family, so I can speak on this, and I can wholeheartedly tell you, truthfully, it is. Being diagnosed with it first, accepting it. Secondly, not giving in to it, knowing that This is only a disease like any other disease. And we have to stay strengthened in our mind and want to be able to, whatever the treatment plan that you go to, you want to be able to be strengthened
Yes.
by
yes.
family, by friends, and encourage that you can do this. You can
Right.
do this.
Right. Now, I want to ask you a quick question. Making strides, is that only locally here in Illinois, or is that throughout the country?
Throughout the country.
Throughout the
Throughout the
country.
country.
Throughout the country,
So
ladies.
remember that, Making Strides organization is throughout the country,
Country.
not just located here in Illinois, but you can contact them and you can make donations, okay?
And just know that October, and just be mindful of this, we don't use one day in October to acknowledge breast cancer. Breast cancer is the month of
Thank you.
October.
Thank
It's
you.
the whole month of
Yes.
October.
Yes.
So if something is placed in the whole month, that's significantly important for us to know what do we need to be doing with this. And then another thing I want to say with this, it's not actually, it's not just breast cancer and wellness, it's a national breast cancer awareness. You just have different organizations who choose to participate, to fundraise, to get donations, to help to provide these things.
I like that.
Yes, I want to know, what should we know about breast cancer as women, our bodies? What should we know? What signs should we look for?
What we want to know, first of all, is that there are risk factors that can predispose you to be getting breast cancer. One of it is women 40 and over. Those are our risk factors. 50. It's 50 and older. Our risk factors are for having breast cancer. A lot of that has to do with our body changes as menopause and estrogen, progesterone is not there. So a lot of that has to do with that. But 50 and older, you're at a higher risk. Being a woman, you're a higher risk.
Wow.
It's very important for us as women. We're always busy taking care of others, and sometimes we forget to take care of ourselves.
Yeah.
So we want to be mindful to take time for a moment to just take care of our health. And this is one way in the month of October to remind us that. Remind us as women, not even as women, as young ladies, we want to educate each other, we want to encourage each other about this. Another issue with what we want to know about this is that there are signs and symptoms. If there's family history of it, does not necessarily mean you're going to have it. For my family, the only history that we have was these two sisters.
Okay.
That's it. But always consult with your physician first. It's very, very important that we always speak to our physician about our family health history, medical diseases that our family history has, so that they can work proactively so that we don't get these diseases. Centers for Disease Control, their recommendation is that if there's some history of breast cancer in your family, you may want to speak with your physician to say that you may want to get your mammogram, is what we do. Mammogram done at age 40. Between 40 and 49, we want to make sure mammograms are done, your first mammogram. First mammogram between 40 and 49. Always, I go right back again, consult with your family physician, with your own physician. It's important that you discuss these things and to determine it's done by your physician. Even though we're speaking of it, we're not making the general conversation of saying what you should be doing. This is information for you to know about being aware of what to do.
That's good. Now, in case you're wondering, how is she so informed about all of this? How does she have so much information? Now, what is your background?
I am a nurse of 31 years.
She's a
Yes.
nurse, so for
31
31
years.
years, she knows what she's talking about. Yeah.
And throughout that 31 years of nursing, taking care of patients, now I'm learning that there's more of educating. I know everybody should know, we should always check our breasts. Women, we need to be comfortable with knowing how to do breast self-exams.
Okay, that was my second question as well. How do we know the process of a breast exam?
Your physician will show you. You can always show you, usually your gynecologist, if you have a gynecologist, will go over and let you know, or even your, if you have just one main physician, your
Family
primary
doctor,
physician,
yes.
you're about doing your primary breast self-exam. A couple of things that you may want to do is make sure that you're not afraid to feel your breast. So you want to feel it because you want to get the feel to see if there's lumps. If there's any lumps in there, we're going to have some of those because that's the makeup of our breast.
Yes.
We have our breast is made up of ducts, lobes. So you have all that in there. So when you feel it, and you feel one side, then you feel the other side.
Okay.
So if you're feeling the same on both sides, then pretty much it's the same. Don't get excited, I'm feeling this love. Okay.
Yeah.
Feel it on one side, feel it on the other side, you feel it on both sides, you're pretty much okay. There's also, you can stand in front of the mirror, and because you want to see the asymmetric of the breast, to make sure there's no differences. So, we're always going to have one a little bit larger than the other.
Okay.
But you want to look for dimples, so you can just kind of stand up in front of the mirror, and then just kind of press up against your hand like that, and just look at your breast. And there'll be, you'll get the breast to kind of move there, but you want to make sure there's no, in the nipple areas where it starts denting in, if you have drainage from the nipples, if you notice flakiness around the nipple area. You want to be mindful of that. That's why it's very important to know your own body. The only way we get to know our own bodies is being comfortable. When we shower in the morning, just kind of pat around, raise your arm, look, because you always want to look under the arm, you want to look all around the breast area, and you want to take a look in the mirror. Stand straight up in the mirror and kind of take a look to see if there's any unevenness.
Okay. And the same, I know men, do they need to check as well?
Men as well.
Okay.
Breast cancer, even though it's predominantly more of women,
Right.
but there is such thing as men getting breast cancer as well, because they also, it's the in the chest area, the breast area, yes.
Wow. Wow.
Yes.
Okay.
Well, Mom, I know we have
Here
this
we go. This gift is for you. You can open it now.
Oh my God. Beautiful. Oh my God, this is beautiful.
Okay, read
Oh,
it.
wow.
Can you read it?
Here we go again. Beauty. Beauty.
Okay, and your bracelet says, "You are fearfully and wonderfully made."
Oh my God.
Okay, so this is a part of a set. It's 5 in 1. She's wearing 1, and we've already given out 4. So you're in a sisterhood of 4 women.
Yes.
So you are connected.
Yes.
So
Yeah, so we
much.
don't have a pen for you, but we did include you and
Listen,
thought about you.
Listen,
Yes.
Yeah,
I love this sister thing
yeah,
because that's what we have to understand. We
Yeah.
are each other's sisters.
that's so true.
So, as I said, I am my sister's keeper.
Yes.
We have to keep being mindful of that.
Okay.
Friends, family. As I said, have you had your mammogram? Is it your time to have you had your mammograms this month?
Yeah, yeah.
And just for an extra note, my hospital, Russell Park Hospital, for the whole month of October, are doing mammograms free for anyone who is
You
not.
need to say that again.
Say that one more
My
Yeah.
hospital, Rush Oak Park Hospital, would do free mammograms for anyone in the Forest Park, River Forest, Oak Park, Proviso Township. They would do free mammograms for this whole month of October. If you know of anyone who has no insurance, if there's someone who, anyone that you may know who is either they want to do their first mammogram, if they just want to, we don't have insurance, it's my time, come get it. And in addition, there is another hospital, which I was really glad to hear this one. This is how important
Wow.
breast cancer awareness is, to
Wow.
give free mammograms.
Yes.
Westlake Hospital
Beautiful.
in Narrows Park for this
Beautiful.
whole month of October
that's
will be giving
wonderful.
free mammograms.
Oh,
this
Free
see,
mammograms.
thank you all so much for tuning in. This segment has been so informational.
Yes,
It's
it
so
has.
important. We know some family members and friends and loved ones who have been diagnosed with breast cancer, and so this is really special to us. I'd like to thank Ms. Davis for taking
Yes,
her time
thank
out.
This is
Oh,
truly,
yeah.
I thank you, ladies.
We
I
had a
thank
great
you.
time, and to let you know, she's gonna give you the information and we're gonna tag it at the end of the video to let you know how you can make donations to Making Strides. And what's the
Yes.
website or the email?
Yes, and actually, you can go to Making Stride. I'm a team head leader, and it's up under
Wow.
Team Helen. That's my oldest sister who I fight for every year. It's
Okay.
Team Helen. I'm the captain, and you can go on Making Strides and give a donation for breast cancer awareness.
Please give, make a donation to Making Strides, and don't forget, if you are involved with Premier Designs, on my website, we are making donations as well for breast cancer.
Yes.
So my website is premierdesigns.com/C Wilcher23. So you can go there and you can pick out a piece of jewelry, if it's a pair of earrings or a ring, and your proceeds would go towards breast cancer. But don't forget Making Strides, because they deal with it personally. The wigs and everything else she was mentioning, it's important
Yes.
to do that. So thank you all again for tuning in, and reach out and tell someone about this information you heard today.
We
Yes.
thank you all for watching.
Bye-bye.
Thank you.
Bye, guys.